This bill today. Nebraska's 3rd District has 55 critical access hospitals, more than any other congressional district. To participate in the critical access program, a hospital must have 25 or fewer beds, provide 24-hour emergency care, and be a certain distance from the next closest hospital. Less commonly discussed are other Medicare conditions of participation for these facilities. For example, these hospitals must have at least one physician on call and available within 30 minutes at all times, and the average inpatient stay at these facilities may not exceed 96 hours. When I visit these facilities, the defining characteristic is that no two critical access hospitals are the same. They each serve a community with unique needs and take on unique challenges to serve those needs. The staff at each of these facilities is dedicated to serving their patients and their communities. They also know from experience what cases they and their hospital can handle and what they need to refer on to a larger facility. However, rather than trusting these providers to follow the existing rules our hospitals are subject to, CMS has sought to further constrain them. By requiring direct physician supervision, CMS is saying they don't trust nurse practitioners, physician's assistants, and registered nurses to perform even the most basic tasks they are trained to do. By requiring a physician certify every single patient will not be admitted for more than 96 hours, they are saying providers don't understand which patients their facility can support. These providers are crucial to ensuring access to care in rural areas, and we should be empowering, not restricting them. This isn't just a provider issue, it's also a common sense issue. At one hospital in my district, which is an older 2-story facility, I was told physician supervision enforcement would mean a doctor had to be on the same floor as the procedure being performed. Never mind a short staircase meant he or she would be no farther from the patient on the floor above them or below than being at the other end of the hallway. I think the only outstanding question here is why, when the score for every annual delay has been 0, and when no one seems to think this policy is a good idea, we continue to delay it year after year instead of repealing it. I want to thank Ms. Jenkins for introducing this bill and the chairman for today's markup. I urge support, and I hope moving forward we can work to repeal counterproductive policies like this and the 96-hour certification requirement. I yield back.
Thank you. Before we turn to amendments, does anyone else wish to strike the last word? Are there any amendments to the amendment in the nature of substitute? Yes, Mr. Becerra.
Thank you, Mr. Chairman. I have an amendment.